So these are actual guinea pig stones. So, so stones and sludge, again, they happen all along the urinary tract. You can get a stone in any portion of the urinary tract. It's a little complicated in rabbits and guinea pigs, so we don't exactly know what causes it. So we do know that in rabbits and guinea pigs, the way they use their calcium is much different than in other mammal species. So they tend to absorb all the calcium they can and then excrete it more readily than we do or other mammals do. So we know that some of it has to do with increased calcium excretion through the bladder and decreased absorption, so meaning that you're having more calcium go through the urinary tract system than actually getting absorbed by the gut. Factors that lead to it, so diet, dehydration, heredity. So if anyone could actually figure out a causal relationship to guinea pig and rabbit stones, they would make millions of dollars, because literally this is the most common thing that we see in practice and no one knows why it happens. So we give recommendations based on why we think it happens, like not too much kale, spinach, which we'll touch on later, but no one actually knows the correlation, knows what the actual causal relationship is. So if anyone wants to try to figure that out, you could make lots of money. Oh, and then the most common stones components are calcium carbonate in guinea pigs and calcium oxalate in rabbits. So clinical signs of a stone or sludge as well. So hematuria is common, so that's blood in the urine. And the reason for that is usually not so much the stone itself, but it's because it rolls around in the bladder and causes irritation to the bladder wall or inside the kidney. Straining, so sometimes, especially when they're so the kidneys have what's called the pelvis, and then in the bladder, you have the little trigone of the bladder, and so what happens is sometimes the stones actually fall so they sit just right in there, and then it can make them feel like they have to pee, but nothing's coming out. So you'll see them like squatting and straining in multiple places. You may notice that they urinate small, frequent amounts. Again, because there's irritation in there, they feel like they have to pee all the time. So, but they haven't made that much urine. So they're just squatting over here, peeing a little, squatting over here, peeing a little. Oftentimes, especially with guinea pigs, they'll be vocalizing. They're like, me, 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 like the whole time they're going to the bathroom. And then you may actually, when there's a large amount of sludge present, you may actually notice a whitish color or gray color to the urine, sediment present. And sometimes you can even find the little stones. So a lot of times they will actually, if the stones are small enough, they can actually pass the little individual stones. Kate Hayes, that's in that room grooming there, had a rabbit that had a ton of stones and passed the biggest stone I've ever seen in my life. I couldn't believe that it actually came out. Stones that are about this size, though, that's not coming out. So, and actually I had one in a rabbit the other day that was literally the biggest stone I had ever seen on an x-ray, and we did have to go in and remove it via surgery, but it was like that big. Like, it was huge. So, so generally, stones and sludge are not that big of a deal. They will often make them uncomfortable. Sometimes it does become to the point where they don't really want to eat very well because they're uncomfortable. So that is obviously important in an emergency, but it really becomes an emergency if they get an obstruction. So a urinary tract obstruction in any species, including in people, is always an emergency. So not urinating for more than 12 hours is an immediate emergency. Usually what we do when that's the case is we'll do x-rays and things like that, and then we'll actually go in and take a fine needle aspirate and suck the urine out, so at least we can give them some relief. Usually at that point, surgery is required to remove the obstruction. And then we always check their blood work because unfortunately, when you have a urinary obstruction, you can often get life-threatening arrhythmias and things like that as well. So treatments, so if we're not obstructed, fluids, we usually will put your rabbit or guinea pig on sub-Q fluids for a few days, give them a dose in the hospital, usually send you home with fluids. We want to decrease the amount of calcium in the diet.